Hello, welcome to my channel. This is Dr. Bess with All Things Nursing. I just want to thank those of you who have already subscribed to my channel for sticking with me. I really do value and appreciate your time. I love having you guys coming to check around on my videos all the time. I am doing this for you also. Thank you for sticking around. For those of you who are new to my channel, I'm talking to you. You haven't subscribed yet, please hit the button down below and subscribe to my channel. Make sure to turn on your notifications and give this video a thumbs up. All right, thank you. So now let's start. What are we talking about today? Today I want to talk to you about some important things that you should consider before you ever think of applying to a nurse practitioner program. Right, important things for you to consider before you ever think of applying to a nurse practitioner program. So now let's start. The first thing, the number one thing that you should consider before you apply to a nurse practitioner program is actually work as a registered nurse. Yes, you heard that right. Actually try to get employment in the role of a registered nurse and work for at least 1 to 2 years. That is what I did. And I think it did help me tremendously in going through the nurse practitioner program I was enrolled in seamlessly. Why is this valuable, you ask? Yes, this is very, very important because when you do work as a registered nurse, you are exposed to what nurses actually do. Before you become a nurse practitioner, you are a registered nurse first. So it will serve you well. In nursing, we have what we call ADPIE, A-D-P-I-E. A is for assessment. This is patient assessment. D is for nursing diagnosis. P is for planning. I is for implementation. And E is evaluation. When you work as a nurse, you are exposed to all these things, right? Your critical thinking skills shoot up. You need this in NP school, right? You are able to interact with patients. Your self-confidence, your communication skills grow tremendously, right? As a nurse, you are able to make nursing diagnoses and come up with a treatment plan for the patient so they get better. All this while involving the patient in the plan of care. And you are able to evaluate the patient to see if they've improved or if they are worsening so that you can make adjustments to the treatment plan. That's what you're going to do as a nurse practitioner. You're going to be diagnosing patients. You're going to be explaining the diagnosis to them. You're going to be recommending treatment options, individualized ones, because each patient is different. And then you're going to be prescribing medications or doing therapy depending on your setting and your specialty, and eventually evaluating these patients to see if they're getting better, right? So make sure you do what is best for you. But I think that getting experience as a registered nurse bodes well for your future as a nurse practitioner. All right, now I've talked about the number one thing. The number two, the second thing you should consider doing is networking. While you are working as a registered nurse, try to network and build a support group of doctors, nurse practitioners, PAs, even nurses. Because when you go to nurse practitioner school, most schools do not find you preceptors. This they don't tell you. Sometimes you find out the hard way when you are due to start clinical, say, in January, and then you don't have anybody. So networking allows you to have people that you can turn to when you're actually in NP school, and these people would precept you, right? For me, I did not have any problems getting preceptors. Why? Because I worked as a registered nurse for almost 4 years prior to going to nurse practitioner school. And while I did this, I was already talking to nurse practitioners, doctors, about my plans and telling them that, hey, I'll be needing your help. When it was before it was actually time for me to start nurse practitioner school, I already had preceptors lined up. So it was very, very easy. I went through the program seamlessly, and that really helped. Today, a lot of students sit out 1 semester, 2 semesters, because they are unable to get preceptors to start their rotations. This means money, time wasted, right? So if you do all this, it will make sure that when you go to nurse practitioner school, it's seamless for you and things comes easily, especially preceptorship, because you cannot graduate without doing clinical rotations. So you working gives you a heads up on these networking abilities to be able to connect and line up preceptorships when you need them, right? The third thing that I want you to do before you ever apply to a nurse practitioner program is do your homework, right? Research on schools. Try to speak to people that have gone to schools. Do not choose a program because your friend went to the program or because your mother went to the program. We are all different people. We have different needs. So let your nurse practitioner journey be on your timeline, on your own time, the school you want to go to based on your own research. There is a lot of school out there, trust me. There's plenty of school. The schools want your money. You are looking for an education, right? Interview the schools. They interview you, interview them, ask them tough questions. Are you guys providing preceptorships? What is it like? If you don't ask questions, they're not going to volunteer this information. Most schools will not. Actually, my school did not. I found out while I was already in the program that I had to find my own preceptors and all that. So make sure that you ask questions that will provide you clarification and help you make an informed decision about your educational needs. Remember, education is a down payment on yourself, on your future. So choose wisely, okay? You are not in competition with anybody. So take your time. Take as much time as you need and make the right decisions that work for you. Again, let's recap. The first thing I want you to do before you apply to nurse practitioner school is actually work as a registered nurse, and I've explained why that is valuable. Number two, it allows you to build a network of clinicians that you can rely on when you need preceptors while in nurse practitioner school. Number two is actually doing your research, your homework on the schools. Do not simply apply because somebody's going there and all that. Do not apply because the school is easy to get into or is easy to graduate from. Remember what they say, nothing good comes easy, okay? And your communication skills, again, like I mentioned, will grow tremendously when you work and interact with patients and exposed to patients. You need all this when you go to NP school. And if you have any questions, please comment, give this video thumbs up, subscribe to my channel. I really want you to subscribe. You watching, I know you haven't subscribed. Please do so and follow me. Again, this is Dr. Bess with All Things Nursing. I'll see you again in the next video. Thanks and bye for now.